What's going on, y'all? You do the intro.
Welcome. We are episode 12 of our podcast, and this is the Merce and Nurse Show. That is the Merce.
I'm the Merce, and then this is the Nurse.
Well, what's your name?
I would hope if you're watching this, know me by now. I'm Noah, and this is my mom,
Barbara. And it is not 30 degrees. Noah's just making it seem like it's cold.
Well, I mean, it's storming outside.
Yeah, we had a bad storm.
It was a little crazy. But no, I mean, shoot. She's been doing it for almost 30 plus years nursing, and I'm just about to start
with lots of stories to hear.
Yeah, here we go, man. But yeah, episode 12. This is for 3 months. We've been doing this every single week.
Yes,
it's been
fun.
It has been fun, guys. But this episode, I title our episodes after, like, in post production, as I'm going back and listening, and because I would listen to our podcast like 3 or 4 times until I'm like, yes, I like the way it sounds. It sounds good, all right. And but anywho, and that's when I think of a name of the podcast, right? Like the last one was Jailhouse Nursing, because we're talking about her. And then the one before that was Family Emergency, about my guy who had the seizure.
Yes.
Remember?
Yeah.
So with this one, I kind of thought about this prior. So the title of this episode is Are You the Doctor or Am I?
Exactly.
So pretty much, like, I want to jump right into this. Have you ever had a patient or family member tell you, this is what I have, I'm taking this, I started on Google, and this is what they recommend for me to take, or I'm not going to take this medication because Google said it has all these side effects?
Yes.
You ever had patients like that?
Yes.
They're like for me, I look at them and I'm like, no, listen, I understand 100%. It's your health. It's your body. Google, study, read what you want to know about your own body. Go for it. I'm okay with that. But when it comes to something like these medications, like these doctors are prescribing you, I mean, you kind of got to be like, don't be like, oh, well, why are they getting that? Because I heard that has bad side effects. And well, yes, but the benefits outweigh the risk for that.
That's
you know what I mean?
True. Yeah.
Because I'll give you an example. I had a patient in ICU. He was intubated. He was the one that told you about the one that came out of prison and he OD'd, and he had his anoxic brain injury.
Yes, yeah.
So
right.
his family was there, or his friend, his brother. No, seriously, the doctor was like, because we saw the brother came by. The doctor's like, nah, man, it's not his brother, it's his brother. We're like,
I'm sure y'all see that a lot in the nursing field, guys.
Oh yeah, but anyway, so he was staying there, and so him, and the common law wife came back, and the following day, and so they're saying, well, what are you doing for him? What are you giving him?
Yeah,
and we're like, well, he's just on antibiotics now because he was septic, blah, 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 and he has an infection. I mean, he has coronavirus, not COVID. He has coronavirus, like the OG virus, like the one, because it's been here for a long time. This COVID-19 is the new variant that kind of took the world by the nuts.
Yeah.
But anyways, so we're trying to explain to him, we're like, well, he's on this medication because to help with his I'm sorry, I said septic. He had pneumonia. It was pneumonia because the coronavirus helped cause pneumonia.
Yeah.
But yeah, so and he was like, oh yeah, well, he's on this antibiotic for pneumonia.
Yeah.
And the dude was like, oh, I've heard about that thing. He goes, that it has very bad side effects. Are you sure you should be giving it to him? And I'm like, and I'm standing on the side. I'm like, what are you talking about? Like in my head, I'm like, because he's talking to the doctor, right?
Yeah.
The doctor's there. Everybody's in there. So we're doing a big old family meeting to see like what's the next step for this patient. Because sadly, he did have an anoxic injury due to an overdose. So he's not like there's no good outcome coming from this, right? So he's being kept alive by machines, literally. And
there's no sun coming through those clouds.
Yeah, it sucks. But I mean. But anyway, so we're trying to explain to him, like, no, like, he's sick with his lungs.
Yeah.
We're trying to kill the infection to help him recover his lung function. And he's like, oh, no. He goes, that stuff has bad side effects. I've read it. He goes, look, dude looked on Google, and he was like, see? It's side effects of diarrhea, constipation. And, I mean, like, she's naming this. And, like, the doctor's like, yes, we understand that. But it's the benefits outweighing the risk.
And exactly, especially at this point.
With any medication. And like, I mean, because some people aren't taking what's it called?
So he's talking about antibiotic that it was gonna.
Yeah, because it causes that.
I'm not trying to laugh. I'm
No,
just
but
like,
yeah.
of all things,
Oh,
he should
dude.
have.
But then he was like, well, he goes, well, he don't have the coronavirus. He already coughed it all out already. And we're looking at him we're like that's not how it works. But then from school, like they should tell us like there's so many people that don't have the health literacy. You know what I mean? They don't understand.
They don't understand.
It's
right.
ignorance.
And especially nowadays, don't you think like when they go through their own portals? Because nowadays they send your lab, your test to your own portal. Like I know here locally we do that. And don't get mad, Grandma, Mom.
Name dropping here.
But the other day she goes,
dropping.
"Oh, I saw my test and I had to look up some words." And I was like, some of those words aren't necessarily bad. They could sound weird or like something's wrong, but that's why
like these big medical terms.
But you should really let someone interpret it for you.
Yeah.
So I'm sure like.
Well, I mean, and like the thing that I understand is like, because I know some people who are on like a cholesterol medication.
Yeah.
I know they do have some bad side effects to it.
Grandma.
And so, but the whole purpose of it is because you have high cholesterol.
Exactly.
So we're trying to bring that level down so you don't, God forbid, throw a clot or have a heart attack. And so it's like one of those things. Yes, I don't like taking it because it makes me feel like this. Okay, but it's helping me prevent me to have a freaking heart attack. It's like you need to outweigh this. And that's for anybody. Anybody that's out there, you need to weigh the risk.
Yeah, and like, I've always heard doctors say you have to give it time. Give it a month.
Yeah,
Or like my thing is, I'm sure you've heard it or you are going to hear it. Well, my friend takes it and she has, this. And, you try to explain everyone's chemistry is different, but.
What works for them may not work for you.
And they'll say, no, my friend had migraines and I don't want to take it. Okay, like, yeah.
No, and then I love when they say, well, Google said, and I'm like.
WebMD was the big one back then.
Oh my gosh. No, seriously, yeah.
I think WebMD was the big one.
But like I said, don't get me wrong. That's awesome. You taking charge of your health. It's really awesome.
Yeah.
But when you're at the hospital, you're on a hospital bed, you're there to seek treatment, at least take the recommendations that the doctor is giving you.
Yes.
Like, why would we want to do anything that's going to harm you?
Yeah.
Don't get me wrong. There are all those doctors out there that may want you to get the extra money. I'm not saying that. But the majority is everybody there is looking out for the best interests of the patient and want to get you better. And so we're trying this. Oh, my God. Okay. So we had a patient. Dude, it wasn't SVT, but it was pretty high up there. It was like she was super tacky, but then doctor's like, I don't know, man, it's kind of looking like SVT right now. So you know what I'm talking about?
Yeah.
Well, so we're looking at the rhythm, and she's very agitated. We're like, and he's like, he goes, screw it, we're just gonna give adenosine.
Uh-huh.
And those of you who don't know, adenosine is a very powerful drug that we use for SVT to help reset it. So break down SVT, the ventricles. It's going super fast. It's dangerous because if your ventricles are pumping too fast. Oh, look, I got heart.
There you go.
If your ventricles are pumping too fast, it's not filling with blood. So if you don't fill with blood, no blood's going out to the body, right? So we want to slow that down. And without going too much detail, I'm not going into detail about SVT, but just know it's pumping too fast, and we want to slow it down because it cannot fill with blood, so your blood don't go out to the body. So what would they do is the most safest way is to synchronized cardiovert somebody. Just put the pads on them, sync up the cardioverter, and like, all right, guys, you're gonna ride the lightning. So just most of the time, like in a hospital setting, because we've done it a couple of times. We call anesthesia, they come and they put them under real quick, and we cardiovert them, bring them out. I know from my buddy Jacob, who's a paramedic, he's like, they ain't got time for that. He goes, we've good luck, boom, and they ride the lightning.
Yeah.
So it works though. But you know what's crazy though? That is actually at the least, because I don't know if you know this, but you always want to try least invasive to most invasive, right?
Yes.
For any treatments.
Yeah.
Cardioverting somebody is actually least invasive versus medication.
Really?
Because just shocking somebody, I mean, it's gonna reset the heart and you can hopefully get them out of that rhythm. But that's all it's really doing. It's
Yeah.
not that big thing. But giving them pushing an IV medication,
Yeah.
you're injecting a medication which can have side effects. It's actually more quote unquote dangerous versus just cardioverting somebody.
Yeah.
But it's pretty interesting. But anyways, so we're there, right? And so she's there, and they're like, "No, we'll grab the crash cart." I'm like, "Oh my god, is she gonna die?" She's like, "No, we're gonna prepare in case she doesn't come back." And I'm like, "Oh yeah," because adenosine, how it works, that's the one where you see them do 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 do, and all of a sudden it goes do, and they flatline for a second, and then it do do, it goes to normal rhythm. Think of it as just like, oh, my Wi-Fi's not working. Let me turn off the router, turn it back on. That's all you're doing. You're literally stopping it and restarting it. Okay?
Are they the ones that come back and say, I saw Jesus and then he told me go back?
I've never seen that, but I've seen guys with adenosine that just sit there and just like, they have a weird look in their face and then doo-doo, their heart comes back.
Yeah.
I mean, the beat comes back. But they say that, I've heard that they say it feels like, it's just like, they don't feel nothing for a second. Like it's weird because yes, you don't feel nothing right now, but an actual absence of something.
Yeah,
of the heart. It's really weird.
Yeah, I bet that is a weird feeling to describe.
So anyways, so we put the pads on her because they're like, hey, we're gonna push this medication, and if it doesn't work or she doesn't come back, then you code her. So we're gonna she had the pads on, so we're good to go.
You're like, just tell me, I'll jump on top of her and start pumping her chest.
I'm like, here we go, baby. I know. I'm outside. I'm like, I'm just stretching. I'm like, let's do this.
Staying alive. Call me when you're ready, guys.
Okay, so we're sitting there, and the daughter's there, and she's asking all these questions. Right? Of course, she's nervous.
Yeah.
And so I'm trying to explain to her, and like, so this is in case, because we brought the machine, brought everything in the room, and she's like, well, this is in case the heart, because the medication we're about to give her is gonna kind of stop her heart, but not like stop it completely, but somewhat,
I like how you say it's gonna kind of.
Well, no, this isn't me saying it, right?
Yeah.
So this is the doc trying to explain to her. It's like, hey, look, so this is what's gonna happen.
Yeah.
And she's like, what do you mean gonna stop the heart? Well, we're not gonna stop the heart completely, but it is gonna look like it stopped, but it's not really stopped.
Just look away.
No,
look away.
And so she starts Googling. She's Googling stuff.
There?
Yes.
As they're gonna do it?
Well, yeah, I mean, we're prepping, right? So
I know,
I'm putting
but-
pads on, and she's
my
like,
God.
no, she goes, this is very dangerous. This is not going to happen. And the doc's like, well, this is what needs to happen because your mom's heart rate, we can't get it back down.
Yeah.
She really don't end medications, nothing's working. We're just going to push adenosine, get the sucker back, right? And so she's like, no, because adenosine has bad side effects. And the doc's like, and one of the nurses, I mean, this was like a whole 15 minutes because she's going back and forth. And we had the med ready to rock and roll. Like, it's really hooked onto the line. And
That can be frustrating.
one of the nurses was like, I think it was one of the nurses or the doc or somebody. And they're like, are you a doctor? No, you're not a doctor. They're a doctor. And I was just like, my God.
But I think sometimes families need to be told that. I mean, because you're holding up time, you're holding up everyone's time, but not that. But the patient, you want to try to fix it as fast as you can. And she was doing that.
It was crazy. But finally, he was like,
she's all, can someone tell me how you spell it again?
I got no one else this. So anyways, we pushed the adenosine.
Yeah.
And we push a flush right behind it, and we're watching the heart rate. It didn't even touch her. It didn't even touch her because you can give 6 milligrams and 12 milligrams.
Yeah.
Do we give 6 milligrams? It didn't even touch it. They're like, whatever at this point, and it just dropped a little bit. And the doc's like, and I was like, I'm waiting for this dude to like her heart rate to stop, and I'm like, and nothing's happening, right? And I'm looking, I'm like, did we mess up? Did something happen? And they're like, adenosine. One of us like, adenosine doesn't work on people sometimes.
Yeah.
I'm like, really? She goes, yeah, I guess it just didn't work on her.
You're like, well, that's a go for me. I'm gonna go.
Yeah, I was like,
I'm gonna go take lunch now.
No, I was like, I'm gonna go check my patients then. See ya. What dude left? But everyone's there. The whole unit like crowded around.
Yeah, watching.
Everyone's gonna, they're preparing for the worst.
Yeah.
And so we're like, well, nothing happened. And like, all right. So everyone just left, and just the nurse and the doctor stayed there. And we're like,
the doctor's like, where's my support system? Where's my support
dude,
system?
It was funny. But then we had this other patient. This is another one that I want to throw out. It's the same place.
Yeah.
In that same hospital. So it was the mother. She was there. Her blood pressure fell, and they don't know why. They're trying to see what's going on. She had a car accident. She had a ostomy, and this was prior a car accident. So huge abdominal surgery, huge. Anywho, she's there. She's the one that gave me that T-shirt. Remember the one I showed you? Yeah, it was her. Anyway, so we're there, and she has an NG tube in her, right? Because they've been giving her meds through there, and she was intubated the day before. So we don't know if you can swallow yet. So the doctor wants to keep the NG tube there in case we need to next procedure, right?
Yeah.
As precautionary. And she was like, I don't want this damn thing in my freaking nose, cussing us out. And then my nurse was like you need it for meds, it's for precautionary. And she goes, because she had, dude, her heart rate was 30. That it was 30. I was counting 1 Mississippi.
And was she like, I don't want this?
No. Dude, she was no symptoms. She was like a regular person. She says she's always been in the 30s, always. And she's not no runner. She ain't, her athletes have low heart rates?
Yeah.
Nope. And so they've done atropine, like they're trying to run these tests, like what's going on, because this isn't normal. But she said, this is what's normal for me. And we're like, but okay. Anywho, long story short, the son's there. I get the son's, mine and Roman.
Yeah.
Like, he's sticking up for you.
Yeah.
So he's going to fight for you. Me, I'm like, Mom, you're on your own. But no.
That's my mom.
No, yeah. So anyway, he's like 19 or 18. He's been with the mom the whole time.
Yeah.
Really good son. Really good son. Because he takes care of her, cleans up her ostomy, does everything for her, right? But anywho, like he's there, and so she's like, I don't want this NG tube. And so my nurse is like, well, I'm sorry, like this doctor's orders, you have to have one in. Yeah. And then she goes, no, I don't want this. And then the doctor is, because they're doing rounds, and so the door's cracked open. My nurse is giving a report to the team, and she goes, are y'all talking about me out there? She goes, I don't want this damn tube in my nose. And so finally the doctor puts his head in. He's like, we need that tube. He goes, I don't want this tube. I want it out now. And then so he leaves, and he's like, he got the patience. Yeah. And so he leaves, and so me and my nurse are there, and the nurse manager comes. Yeah. Cool guy. He's a real awesome, smart guy. He comes in. He's like, Ma, like, what's going on? Yeah. And so she's like, I don't want this thing. And the son starts saying, the son starts saying, she has a right. If she don't want that, she don't have to have it. And he's like, no, you're right. She don't have to. But he kept saying that over and over. Yeah. He goes, you got to take it out now. And we know our rights. Here's
the leaving against a medical advice.
That's what I'm saying.
Okay,
and he kept fighting. and he's the same guy from the other time. Yeah. From the other one. It was the same thing. It was like, are you, he goes, I don't have a medical degree. Do you have a medical degree? Yeah. To the son. And son's like, no. He goes, I don't want either. I'm following the orders of the doctor because he has a medical degree in ICU, critical care for 25 plus years. He says we need this tube, and we need to have it. Yeah. And so they kept going back and forth. I'm just standing there. I'm like, what am I like? What's going on? Like, am I being punked?
Like in your opinion, did you feel like y'all came here for something? You can't pick and choose. Okay, I don't want an IV. But I need IV meds. I mean, the thing is, when you go to the hospital, yes, I know you should question. You should, a little bit of research. But at this point, I mean,
no, that's what he said.
I'm sure. I mean, I know inside you. I know we all talk in our heads like, why don't you? Can you please ask for the against medical advice form?
No, seriously, that's what he was saying. He's like, y'all came here for help.
Yeah,
we're trying to help you. Yeah. Like, we're trying to help you. This is what we need to do. And so, but they go back forward. Finally, he's like, and he was like, you know what? If you don't want it, you can take it out. Yeah. And he goes, but we're not taking it out. Yeah. So if you want to pull it out, pull it out. Dude.
Hold on, Ma.
Dude.
Count to 10.
Well, the mom was saying to pull it out too. Yeah. And so we leave. We come back to check to get some meds. And she's like,
what do I do with this?
No. She's like, are you going to, you give, and the son's like, are you going to give me stuff so I can pull this out? And my nurse was like, no, like, I'm not giving you nothing. Like, if you're going to do it, this is on y'all. We're not taking no part of this. Because we can't.
Yeah, of course. Let's be liable.
And as we're walking out, she turned around, she goes, but I'm going to give you an advice. Pull it out fast. And so we leave.
Oh, you're like 1, 2, 3.
We leave.
Right or not?
We come back. And the NG tube's on the ground. And I'm like, oh my gosh, they pulled it out. He pulled it out for her. Exactly.
Oh my god,
dude! I swear, I thought I told you this. I'm sorry, dude.
People are like, really?
That's what I'm saying. But like, dude, they pulled it out. We're like, oh, okay. I picked it up, threw it in the trash. I'm like, After walking into patient's room, noticed NG tube on the floor. We'll continue to monitor.
They both had a blank stare at me in the face.
As she has mucus going out her nose.
You're like that. Well, we're gonna go ahead and we're gonna empty this room. We're gonna need it for the next person who's gonna want to be cooperative.
Man.
That
no,
is
that's
crazy.
what I'm saying. Like,
that seems like the consensus of people
like if
now,
you
right?
go, if you're going to these, I mean, you go into the hospital for seeking help.
Yeah.
I mean, unless you're actually a doctor at the same time, especially with nurses too.
Yeah.
You know it. Nurses are probably the worst patients, but I've had a couple of nurses in my patients before, and half it's like 50-50, man. Like half they're like, oh, you shouldn't be doing that. You need to do it this way. Like they're telling me how to do my job, and I'm like, all right, cool. Which I mean, that happens anywhere. Anywhere. People do that, right?
Yeah.
But then thank God there's the other 50 half are like
exactly.
They just sit there like, all right, you do you.
Yeah, do you?
And like I love it whenever I'm taking care of a patient, I'm doing some IV medication on them, blah blah blah. I get done and they're like, wow, you did really good. I'm like, oh, thank you, appreciate that. She goes, yeah. She goes, I remember starting out fresh too as a nurse and blah blah blah.
Oh, yeah.
And I'm like, oh, you're a nurse? She goes, yeah.
Those are the good nurses.
She was like, yeah, I've been a nurse for 35 years, and I'm like, oh. Oh, and then there's no awkward. It's all awkward next. I'm like,
man, they go wash my hands and sing happy birthday, happy birthday.
You're right there. You're scrubbing their IV port for 30 full seconds, and they're looking at you like, you can stop scrubbing the port.
You're like, ma'am, can I give you some fresh water?
Oh my goodness, dude. Oh man, but
crazy.
I mean, and also, if you have family members who are on Lantus, Semglee, the long acting insulin, and they're diabetic, I hope, and I'm telling you, I know our show we're not supposed to give medical advice, and we aren't. I'm just saying, know your drug and know that you're not the doctor, because Lantus is a long acting, so it doesn't have a peak time. Yeah, it's for it to be for 24 hours. So if you check that person's blood sugar and it's, oh my gosh, it's 150. Do not increase their insulin of what the order is, or if vice versa. If their blood sugar is 60, their blood sugar is low. Let me give them half of what the insulin is supposed to be. No, please don't do that, because it's a 24-hour insulin. It's not Humalog. The regular insulin, when it's right there and right there. That's the one. But you, I love you to death, Grandma. I love you to death, but please stop.
I bet Grandma's all.
I know. When you're watching this, just know that I love you to death. But please stop messing with his insulin. He's fine. Okay? Okay.
As soon as she watches this, she's going to be like, who the hell you think you are? I am the grandma. I'm older than y'all.
Dude, I'm going to have to edit this out, man. Well, probably not, but oh my goodness.
She knows it's all good humor. Oh, I wanted to tell you something. I wanted to tell you something so funny.
What's up?
So we have a psychiatrist that goes to the jail, right, every Friday, and they talk to them through Zoom. A psychiatrist, like a
Zoom. What do you mean Zoom?
Like through the computer. He doesn't come in person, but he talks to them on computer. But he has all their information before he does a visit.
The inmates?
Yeah, talk to the psychiatrist.
How do they talk to them?
Through the computer.
They have a computer? They have access to that?
No, it's in medical. It's for us.
Okay.
But don't get me, but like I said, the psychiatrist, the day before, they get all their notes, all their Mars, everything. So he's such an intelligent man. So anyways, I had an inmate in there, and I, speaking how families are and people are. Yeah. So he's like, and he's really rough, right? And hey, I'm not talking about him like that. I'm just like, I was just listening to him. He goes, so are you changing my meds, doc? And the doc's like, yeah, I'm at this and this and this. All right. Well, what color are they going to be? Because a lot of the inmates there, manufacturers, every once in a while they'll change up. It was pink for years. All of a sudden, it's purple. Yeah. They will freak out. They'll be like, "What is this?" So anyway, hey,
at least they're on top of it. At least they're on top of the meds.
I know. And it was so funny. He kept saying, well, what color are they from the manufacturer? And so he's telling him, and he's so patient. Okay, this one, it's like a yellow, and this one. And then he goes, and then I just started kind of like, giggling to myself, because he goes, well, are there any recalls on these medicines? And I'm like, I just crack up. And I just thought that was funny. Because, it's like you said, families, they're so, they just, look at everything. And anyways, I just thought that was kind of funny.
That's pretty funny, dude. Oh, my goodness.
Oh, well.
Shoot. Hey, so you were telling me last week about...
oh, yeah. I was telling you a story. Because it's been in the news, last couple years. Nurses have been, kind of, getting to, especially nurses who work like an ER, which that's where you're going to be going. When you get hit and assaulted, because it is assault. And I'm not saying someone who is,
it's really hard.
Disability,
you think it's really hard. Like, how do you
defer? Like, is it really like, are they really in their mind? They're having a psychotic episode. You can kind of, but people who, let's just be honest, who do for the most part know what's going on, and they're just, they don't want to be there, or maybe there's a cop there in the next room, and they got, sometimes you get arrested and you go and you get checked out.
Yeah.
And so they've really been banding together, like, you know what, let's change the laws. And it does take everybody to do it, because assault's assault. But like I said, I know there's no excuse, but there's different circumstances.
Yeah.
So I was telling Noah that this nurse, she worked in the ER. I think they were, what was her name? But anyways, so she worked in ER. She was pregnant. And this lady was brought in by her husband because he was like, something's up, something's wrong. Well, she purposely kicked her in the stomach. So after that time, the nurse was like, hey, I'm pregnant and you just kicked me, like cut it out. And on purpose, that's what I'm saying. She purposely
did it again. So I did look it up, and so it does say that on April 6th, she was found guilty of 2 counts of aggravated battery, which is a class 3 felony.
Yep.
And sentences for aggravated battery can range from probation up to 5 years in prison. And in her actually sentence hearing is scheduled for June 15th. So it's coming
we're
up.
kind of curious to see which way it
goes. But
I mean, like I said, there's gonna. I'm sure, like you're going to be getting a lot of drunks.
just like that one person. Remember that one nurse? She just spit. Oh, it happens all the time. The guy knocked in the mouth. From that one patient. Oh,
yes,
man,
I mean, you're gonna, you're gonna. I mean, y'all gonna have to decipher what's true assault.
It's in the background playing the song, the final countdown. Oh, here we go, guys.
And I went when I went to the hospital today to go visit someone the other day. I'm in the elevator and it says like, we are, we do not, cuss, fight, it's all these rules. And I'm like, oh, okay. All right. But I thought that was kind of, hey, you know what? That's the warning.
Let me ask you this though. When you were in a nursing home, you ever hear stories about people, exploiting the older people, the residents, like stealing stuff or you know what I'm talking about, like exploitation?
Yes. Yeah. And I've also heard of people that, and of this
I guess family too. I guess family too.
She used to be a caretaker. Yeah. And it happens. Like my thing was over the years, I'm not saying it was recently. I just remember over the years, these people would win bingo money, $1.
Yeah.
And they'd be like, and they saved them. And I mean, these people can have like $15 after a month. And then it would break my heart when they're like, someone took my money, because they know where their stuff's at. Or someone took my soda they want. That would drive me crazy. And those were little things, though.
Well, that's the little things.
What?
But this is something just a little bit bigger.
Uh-oh.
So in Volusia, oh my God, I can't even say that county. It's in Florida, though.
Okay, Florida. Oh, Florida.
Florida again.
Oh, it's in the news.
A CNA accused of using Alzheimer's patient's ID for plastic surgery.
Now, was this at a care center?
No, this is it's a in-home caregiver in Deltona. Is accused of defrauding her older Alzheimer's patient of more than $7,000.
And she got what?
And because she opened a credit card with it in the patient's name and used it to pay for plastic surgery. She's 31. She got herself a Brazilian butt lift and liposuction for her arms.
And Florida's known for cosmetic surgery, so I'm sure she went around to the clinic around the corner.
But she's been.
So how did they find out?
The husband was saying that they were looking. He looked on the wife's, like, you know how like when you run a credit, they send you a notice.
Yeah, they'll tell you that.
He was like, she got a notice and there's a credit card bill in the wife's name with a balance of over $7,100, and he was like, my wife's not getting liposuction or Brazilian butt lift.
Honey, do you remember this? Honey, do you remember this?
Yeah.
7th.
But no, but they caught her and she's.
Is she gonna get prosecuted? I mean, like.
Yeah, well, no, she is. She already got released on bail, but.
I would suck that fat out of her butt and
get my money back. Put it back in. Put it back in. Oh my goodness, man.
That's too crazy.
We're coming to an end already.
Yep.
But shit, that was a good show.
Yes.
I guess. Do you have anything to leave off with today, or if you don't, because I'm pretty golden.
No.
She don't have notes, guys. She wasn't ready for nothing. Just let you know.
I got my notes from last week on my daughter's. On my granddaughter's paper.
That's not a rebel flag. That's not a rebel flag.
It's not. It's just. Anyways, I use her schoolwork for a note paper.
Oh, I took her swimming today. Went to the pool.
Y'all went. It was hot
it
today.
was nice. Yeah, no, we got home and we went to the pool. Right.
Oh,
and so we got here and I was like,
how was the water?
I was like, yo, we go swimming. They're like, yeah, it's all right.
Yeah.
So the kids we went out there. It was cold, but once you in there, it was fine.
Oh, did they like it?
Yeah, and then there was this one kid who was, oh my god, dude. Like
There's always one.
There was one kid. So we're off in the corner, just us two,
Yeah.
just me and Soph and we're just swimming, just talking. And all of a sudden, there's all these little kids, like a group of kids, and so they start coming towards our side. I'm like, oh, whatever, no big deal. And he finds this leaf or something, and so he's and I see him throwing it, but throwing it in our direction, but M. So it's me here, M, Soph, and the kids behind M, so like behind you, right?
Yeah.
And so I see him trying to throw, but like it's a leaf, so like
So
the wind's blowing it. And he gets it, and he's trying again. I'm looking, and he gets right behind her. He gets behind her and gets it and puts it on her head. And I looked
How old was he?
He's like maybe 9 or 10 years old.
Okay,
and I
older
looked at
enough
him.
to know better.
Yeah, I looked at him. I said, hey, don't touch my kid. And he was like, and he got scared. I'm like, back off.
Yeah.
And so I grabbed M. M came to me. You know how she gets,
Yeah.
she came to me. And I look back, and her family, they're just boozing it with Bud Light. And I'm like, man.
Let me let the HOA know. Ed, my husband.
Well, that's what I'll call in the pool. We have signs everywhere, just saying.
Yeah.
But no, I said, did you get your damn hands off my kid? I'm like, no, there's nobody to teach like personal boundaries anymore.
No, and also parents don't give a crap.
Oh, I was like, man, I almost slapped a kid today. I would have gone to prison. But anyways, I'm gonna leave you with something before we close out today's episode. All right. Never regret a day in your life, because good days give happiness. Bad days gives experience. The worst days gives lessons, and the best days gives memories.
I like that. That's good.
So that's all I gotta say to all. Oh my Lord, I just had a stroke. That's all I gotta say for y'all. Thank you for hanging with us.
Thank you, guys.
Share it, pass it around. Find us on YouTube, Instagram, Facebook.
Yes.
Anywhere, Spotify. But that's all I got. Well, that's it.
Do I want her Venmo?
What?
I'm thinking
Sponsor? You want to sponsor us?
when you go on TikTok, when you go to the creator of
Yeah.
they always put the Venmo and Cash App.
That's so weird.
I know. I'm like, why?
No, that's weird.
But here's my Venmo.
All right, guys. We'll see you later.
Bye.
Have a good one.
Bye.